Hi, I'm Dr. Arundathi, consultant dermatologist at Dr. Sculpt Aesthetic Clinics in Indiranagar and Sahakarnagar, Bengaluru. Fillers are injectable treatments where substances such as collagen, hyaluronic acid, etc. are injected into the skin to fill out certain hollow areas, to correct certain volume deficits that happen as a result of aging, and also to contour and to augment appearance. Since hyaluronic acid fillers are the most commonly performed fillers worldwide, I'll be talking about them today. So we'll talk about facial fillers specifically in this talk. So the areas in which where fillers can be injected are forehead to fill out hollowness and to give a nice rounded appearance. We can inject it into the brow to give a lift. We can inject it into the underneath your eye to fill out this tear trough deformity. It can be used to contour and augment your cheeks. It can be used to fill out the hollowness in the lower part of your cheeks. It can be used to augment and define the chin, the jawline, and also the lips. It can be also used to lift the skin. Fillers, as an anti-aging treatment, can also give a subtle lift to the skin when injected strategically. So this is called a liquid facelift. Though fillers have this amazing capability to augment appearance and to take years of your face in one sitting in the clinic, there's still a lot of misconceptions surrounding the treatment. Though fillers have the ability to augment appearance and to take years of your face in one sitting in the clinic, so there's this misconception that fillers can make you look unnatural. So when done well, this is simply not true. So how a trained injector goes about doing fillers is, first they'll assess your face, try to understand your expectations from the treatment and plan the procedure out carefully. So they'll plan out where to place the filler, how much of filler to place, and this will give a very natural and subtle yet significant difference to your face. When done properly and with proper planning, it can give you great results without it looking like some work has been done. In fact, many celebrities that you see have had fillers done, but you still can't make out that they have had work done on this. Most hyaluronic acid fillers usually last anywhere between 1 to 2 years in your skin. And patients have this misconception that once the filler sort of like fades away, the effect of the filler fades away over time, their skin is going to sag more. That is not true. Filler does not stretch your skin or make your skin sag once it is inside your skin actually. So, like I said, the filler substance is hyaluronic acid, which is in fact a natural component of our skin. It is identical to the hyaluronic acid which is present inside the skin. Once injected, the filler very seamlessly integrates into the skin and it does not stretch it or make the skin sag. So patients often ask me, I don't want to keep doing these filler treatments. I don't want to repeat them every 2 years or so. Can you suggest some creams or some skincare regimen which will replace the effect of fillers for me? This unfortunately is not possible. Even if you apply hyaluronic acid on the skin, it's not going to get absorbed into the skin to replace the effect of fillers. And here I would like to warn patients about these do-it-yourself treatments that I've been seeing a lot on TikTok, on YouTube, where patients use these filler guns to inject themselves with filler. It looks quite scary in fact, and it is fraught with risk. There is a filler as done in the clinic is an extremely controlled sterile procedure where your skin is sterilized before procedure and we use sterile disposable needles to inject the filler in. When you do these treatments by yourself at home, you are not injecting the filler at the right place, you are not using the right amount of filler, and there is always a risk of bruising and infection when these treatments are done by yourself at home. I would advise patients to strictly avoid doing these things by yourself at home. So, when performed by trained practitioners using a sterile technique, they are 100% safe. So, hyaluronic acid fillers have to be the safest because they don't even incite an allergic reaction inside the skin when they are injected. And finally, are fillers painful treatments? So we usually numb the skin before we do the treatment using a numbing cream. That eliminates the pain of the injection. The fillers also come pre-filled with a little bit of lignocaine or local anesthetic, which make it very comfortable when we inject it into the skin.